us about a herniated disc. This is a phrase that people hear all the time. Is this a herniated disc a traumatic injury, or is it caused by repetitive stress?
So that's a great question, Andrew, and herniated discs are something I deal with on a daily basis, and the answer to your question is really yes, both. If we look here, you can see the blue area in between the bones, and that's your disc. That's softer and has some sort of elasticity that allows for you to have shock absorbance. It's generally held within a very tight boundary. As we age, as we have stresses on our bodies, that boundary can start to thin out, and it allows a herniation or a little piece of that soft inner core to come out. The problem with that is that there's not a lot of extra space where your nerves are. And so when that little piece of disc comes out, it may seem very small, but it can brush up against a nerve and irritate it, or it can even compress the nerve and actually start to damage it.
And when you feel pain in your lower back, because it is the spine, you can feel pain in other areas as well?
Well, yes. So typically the type of pain that you have there is what we call radiculopathy, and what a lot of patients tend to refer to as either sciatica or as pinched nerve. All right, and what that does is, even though the problem's in the spine, the patient notices symptoms radiating down their leg in some specific pattern. And what that means is the nerve that's being pinched up in the back is really just responsible for innervation along that line.